Hello, everyone. The social justice issue I'll be discussing today will be seeking dental care among the Hispanic community. With existing dental programs and low-income dental insurance programs available, it still has not taken effect on everyone. One of the most affected are those within the Hispanic Latino community. They are one of the most common populations that are rapidly growing. The U.S. Hispanic Latino population consists of individuals whose ancestors were originally from various countries in North America, Central or South America, the Caribbean, and Europe. Even though they are one of the biggest populations in the United States, they do have the poorest dental hygiene care when compared to other racial and ethnic groups. Why does it happen? Many of the reasons why they have poor oral health is due to low to no insurance coverage. Income does not meet the treatment costs. There's a language barrier to be able to access care. They have transportation difficulties, meaning they might not have a car and they have to take the bus to get to where they need to go. And also, there are long wait times at the clinics. When they go to public clinics, there are many patients who go to go get treatment and they have to wait and spend a whole day at the clinic. Also, the lack of knowledge, most of these people, due to as well as the language barrier, makes it harder for them to be educated. Lack of knowledge and language barrier play a conjunction role. With not many Spanish-speaking providers in dental offices, it makes it harder to educate the patients on the importance of treatment and oral hygiene. Without knowing the importance of oral care, it leads to risk of periodontal disease among adults and tooth decay among children. Due to language barrier, many Hispanic patients choose not to go to the dental office because they will not be able to communicate with the dental provider to help them with their oral health needs. Also, for those who do go to the dentist, have difficulty understanding what the hygienist or dentist is saying upon oral hygiene instructions or treatment planning. We do have show tell do method available for minimal instructions for our Spanish speaking patients, but it's still hard for them to be able to understand what is being instructed and for them to implement that information when they go back home. On a survey I conducted on 68 participants, 69.1 answered that they are Hispanic Latino ethnicity, while the other 30.9% were not. They were asked if they use dental floss upon their oral hygiene care. As we have here in the graph, we can see that most of the population within our Hispanic members, they answered no or sometimes when using floss. Whereas compared to non-Hispanic Latino members, they answer yes. So we can see that there is a difference there upon our members on being educated on the importance of floss and how using floss can help take away all that bad bacteria from in between the teeth. Another thing our members need to be educated on is the different types of toothbrushes available for them to buy. As we know, super soft and soft toothbrushes bristles are the best for us because they are not so harsh on our enamel. And as we can see here in the picture on the bottom left, this is a picture I took at a Mexican supermarket. They have many toothbrushes available, as we can see, very colorful, very eye-catching. But as we can see, they are medium bristles. And we do know that if not used adequately, these medium bristles toothbrushes will cause harm to our tooth enamel. Dental visits should be a normalized routine for everyone, not just when it is an emergency. We do know that many of these adults have high susceptibility to periodontitis, and they tend to lose more teeth in comparison to other populations. Although there are treatments that can be provided to help with the missing teeth, most Hispanic or Latinos cannot afford them. Most treatments like crowns, implants, root canals, and dentures are either not covered or partially covered by insurance. And due to the high cost, most of these members would rather just get a tooth extracted than to get treatment. When asked in the survey when was the last time they saw a dentist and for what reason, most answer were 2 or more years ago, and due to getting a tooth extracted, due to a broken tooth or failing, or due to toothache. Very few of them said that they went because of a dental cleaning. In comparison to the non-Hispanic members, which said that their visits were more frequently between 3 to 6 months ago, and it was for dental cleaning. Dental appointments would be more frequent if patients had dental insurance coverage, as mentioned, and if the costs were less. Participants were also asked, if you do not visit the dentist frequently, why is that? There were 5 top answers as a result, as we can see here in the graph, and those were no pain, no insurance, cost of treatment, don't have time, and I have work. All of these top five answers have a strong correlation with each other. Hispanic members do not visit the dentist frequently unless they have pain because they have no insurance. For those who do have insurance, have very little coverage and still have a copayment. Therefore, due to treatments being so high in price, most of these patients need to work more shifts to be able to afford the dental treatments, aside from their living expenses. The participants on the survey conducted were residents from the Los Angeles area, so living expenses are very high for them. Lastly, another question that was asked was, do you prefer to miss a day of work so you can go to your dental appointment? Why or why not? Within the Hispanic Latino respondents, they said no, they would not prefer to miss a day of work because they need the money. Others said they would rather go when they are not scheduled to go to work so they don't miss a day of work for that same reason, to not lose their income for the day. Very few of them answered that yes, they would miss a day of work to take care of their oral health, just as many of the non-Hispanic respondents answered. In order to improve these issues, there should be a better insurance system that helps cover for them and what they need, and low insurance prices as well for them to be able to afford to pay for them as well in case they can't be fully covered, as it is well documented that uninsured persons are less likely to have a regular source of care, less likely to receive required preventive services, and less likely to get dental care in comparison to a person that is insured. We also need more Spanish speakers. If there are more Spanish speakers, it would be easier access for all of these patients to be informed on insurance coverage and also on oral hygiene instructions and better explanation of dental treatments. And then another option would be implementing a Spanish language class within dental school programs so the students can learn some of the common terms used in dentistry to be able to communicate and educate these patients. Also, there needs to be more informational pamphlets in Spanish. There needs to be more so that all of these patients could take all that information home, take their time and read all that information and educate themselves as well in case they had trouble understanding the dentist or the hygienist when they were at their appointment. Lastly, more openings of free or low-cost dental clinics should be available for these people who cannot afford to go to a dental clinic. For example, there is the free clinic of Simi Valley that provides free dental and medical services for their community members. All they have to pay is a small donation amount, but it's definitely more affordable for them to pay. So with just a little help that this clinic is doing for the community, it's already helping improve many people's oral hygiene health. As time progresses and the world returns to normal after this global pandemic, hopefully there are more resources available for the Hispanic Latino community members so that they can have access to routine dental care rather than emergency visits when they have pain. These are my resources. Thank you.